So this is a short webinar. We'll talk about part of the product we offer through AQ, and then if you have any question, you can type it, or you can just click on the mute, and you can unmute your mic, and you can just shout it out to all of us. Perfect. Can you guys see the presentation? Yes? Okay, perfect. So today we'll be talking about the regenerative medicine in general, and particularly growth factors and how they operate and how they work. So what is regenerative medicine? So regenerative medicine is a branch of medicine that develop methods and that regrow, repair, or replace damaged or diseased cells or organ tissue. And when we talk about regenerative medicine, we're actually talking about growth factors, stem cell, and exosomes. And here, I think it is, regenerative medicine is amazing tools that we can use in our aesthetic practices and in medicine in general. The problem is that there has been a lot of bad information circulating in this field. And because of that, sadly, a lot of people have lost, didn't believe in it, or lost interest in these things. And it's sad to see that, but it's industry that comes with a lot of, So I will try to help you clarify a lot of as much as I can. And if you have a question, please feel free to share with us. So regenerative medicine. So how do we explain regenerative medicine in as simple as we can? Let me see. Oh, yes. So what we've done is simple. We took a skin and we caused an injury to it, like a puncture. And then we put it under the microscope, and then we run the camera on top of that. And we want to see how did the growth factor actually help regenerate and repair the skin. And this way you will get really an insight on really a proof how these things work. Because right now, I think a lot of the people who will hear about regenerative medicine, growth factors, stem cell exosome, they hear theory and they somehow construct their idea of how this works. I think it's the best thing to learn about it is by visualizing how things work in real life. So this is what we've done. So once there's an injury and you apply growth factors in this injury, the growth factor will come in here and then will signal a message to the blood vessels, one of them, and then the blood vessel will dilate, and then this, what I'm circling right now, is a stem cell. You see, once you see around cells, it's a stem cell. Then it goes up to the site of injury. And there, the growth factor will give it the signal to differentiate and fill in the gap. You see a lot of macrophages, lymphocytes coming to the site to clean up the whole process and make it, clean it up and take care of the microbial. So this is really what we try to achieve when we talk about regenerative medicine. So how did this work when it comes to us? So basically, we patented the technology that allow us to use this growth factor that I just showed you that will work to help repair the skin. And then we developed a method called growth factor induced therapy, which is the therapeutic method to utilize this growth factors to therapeutics. So basically, in summary, the use of different modalities in combination with growth factor like microneedling, laser, energy-based devices, chemical peel are considered to be growth factor-induced therapy. Now, these are the theories. So how do we put this in practice and prove it? So there's a publication that came actually from the UK. This is done in the University of London and King's College University. And what they did is basically they took growth factors, or they took patients from different ages and different ethnicity. In this particular paper, they used Asian, Chinese, Caucasian, and Latinos. So you have different Fitzpatrick and different skin types. And then they use the recovery serum, which is from the AQ product that have it's a professional product with high concentration of growth factors. And then they combine it with microneedling. And then they want to see if this will have any effect on this patient. So they picked up, these are the group of patients from 20 to 29, 30 to 39, 40 to 49, and 50 to 59. And they noticed like a lot of the improvement that have taken place for the patient between 40 and 49. And this makes sense because people who are 20 and 29 will not, their skin is not as much damaged, so their amount of improvement is way less than you see somebody who are in later ages. So this makes sense. And they also look at different indications. They look at brightness, they look at overall skin texture, appearance, skin texture, tightness, pores, wrinkle, pigmentation. And they noted that there are this technique with growth factor have improved all type of skin, and they have all these indications. And they use Visia to record all these metrics in the skin. So here they talk about, they conclude that, this study used AQ growth factor, and the reported efficacy of this treatment modality cannot be extrapolated to all other growth factors. So here they say, not only you should not just rely on the growth factors, of the product, but it's very important the quality of the growth factors to get this result. They also talk about why they pick up this growth factor as opposed to picking other brand in this case, and they said, they set up some criteria like the source of growth factors, where it come from, the manufacturing processes, and so forth. And AQ have met all these criteria, and this is one reason why they used it in this study. This is another study published in the University of Cairo and the National Research Center. And here what they've done, they did a split study. They took a patient and they did a split phase study. Part of it was done with laser alone, and the other part laser and growth factors. And they want to see would that make any difference. So they used the DECA system, Smart Sight for laser, and then they use AQ recovery serum for the source of growth factors. So the first thing they looked at is healing time. So patients here who received laser alone without growth factor have healed in average 12 days. When combined with growth factor, the patient pool or group have healed in 6 days. So here they cut the healing time by half, which is great significance because once you cut the healing time by half, you reduce the great deal of complications that come from laser, especially like for people in Egypt whose skin are like Fitzpatrick 3 and 4, they're more prone for post-inflammatory hyperpigmentation. So here saying by healing fast, you avoid this problem. The second thing is they found out that actually also the outcome when combined with growth factor is much better. So not only you have fast healing, but even the outcome is much better when combined with growth factors. So here they recommended the use of growth factors when using ablative lasers and any treatment that combined with that compromise the skin integrity. And they also they discussed a little bit about PRP and how this will be superior to PRP because PRP depends on the patient health to get result, and you don't have any gauges on which growth factor are in place. Wherein you have already made growth factors, then you have great control and you always have predictable results. But this is something that discussed in this paper. Another paper published again used for patients with radical dermatitis, which is basically a condition combined with people who undergo radiation for cancer treatment. 95% of the people who undergo radiation develop, or 95% develop something called contact dermatitis. At time, there's no agreement or a recommendation treatment for dermatitis. So this is how the dermatitis look like. It's like a third-degree burn, which is it's like cooking the skin in a microwave. This is how it looks like, and there's no treatment for it. So here, the author decided to recommend using the AQ active serum as a source of growth factors and to apply on the patient twice a day while she's undergoing the treatments. So they follow the patient, and then they found huge amount of improvement. Their conclusion was this treatment have showed rapid and orderly healing with a significant reduction in pain and virtually no scarring. So Another use growth factor, not just for aesthetic, but also for clinical treatment like rheumatoid dermatitis. This paper got published again using for patient with diabetic ulcer. This patient is 65 years old with type 2 diabetes. He had a fracture in his tibia and they have to be operate on him. However, 6 months after the operation, he failed to heal at the far proximity of his limb, of his leg, which is pretty typical for people who undergo, who are, not uncontrolled diabetes. So in this case, for 6 months, they treated him with antibiotics and many other modalities and did not work. So at the last resort, they used growth factors, which is the AQ recovery serum here they mentioned, and the patient healed within 27 days, which is speed lightening for people who have diabetic ulcers. So another usage of growth factors, not only for aesthetic, but also for treatment of medical condition. So this patient, 92 years old, type 2 diabetes, taking blood thinning, she had melanoma, whereas she's square. She got treated for her melanoma. They cut it, they did surgery, they cut it, but while she's doing the operation, she continued to bleed quite a lot. So the doctor decided to cauterize the area to stop the bleeding. And after that, of course, when they start cauterizing the arteries, they left the oxygen tube in her nose. And when you have spark and pure oxygen, in the operation, she got this accident explosion on her face and burn all over her face. So it was terrible. Of course, her son is a friend of mine and patient. So he called and he called many other doctors to help. And of course, simple. We just cleaned it up. We applied recovery on the area. And then we followed her. And in 2 months, she had full recovery like it never happened for 92 years old. Acne, she came for Botox and fillers. And you can see if you do Botox and filler for a patient who have bad skin, you're not going to get good result. She's not going to be fully satisfied. So we took care of her acne by doing microneedling with recovery serum. We did on March 15th, and then we follow one on, a month later, and you can see the whole improvement. And then now you look at her lips here, we did her lips and fillers, and before not, and you can see the difference in her face. So growth factor can be always used before using fillers in case the patient have a very bad skin. This is a paper published in 2017, and it's went viral, this paper, because what they did, they showed an improvement rate of 93% for hair. People who have no hair or have alopecia androgenica, no treatment recordedly have shown this type of improvement ever. So this paper came out and showed this type of improvement, which is amazing. But not only that, actually they did split head for the patient to show that, when you use it like using modality laser alone and then with growth factors, and they showed that with the growth factor, you have amazing improvement in the same patient, more scientific this way. In 4 months, you have full growth in the area. And not only that, but they say the quality of hair is much better. And they measure the thickness of the hair that improved over 30% to normal hair, which is basically giving reference to how the follicle is getting healthier and better by using growth factors as opposed to like minoxidil or finasteride. And they use the AQ hair complex for this in this paper to prove efficacy. And of course, you can see the protocol here. And it won the best product of the year 2018 till today. So the stem cell product produce growth factors. One of the, one misconception here is a lot of people assume that stem cell produce growth factors. Stem cell do not produce growth factor, as I show you in the video. The stem cell require growth factor to be activated. But, a lot of companies, a lot of people assume stem cell and growth factor always come hand in hand, which is not true. So if you get marketed that's the product have a growth factor from a stem cell, then they're lying because science does not support that. So this is some of the marketing tricks that the companies do because they know a lot of the practitioners, they don't know, they know very little about growth factors. So they can, put the stem cell, which is a buzzword right now with like stem cell, growth factor, and then, you get in the mix. And of course, you use unproven products. Also, if you use growth factors, anything that is not sourced from a human, like plant-based growth factor or any plant-based biologics, using a human is nonsense because plants or any other specimen different than human will not work on a human. So we see a lot right now, people talk about like, oh, this is a growth factor from a plant or whatever from this and that. Of course, that's not going to work on a human. It's just common sense. Not, like even if you don't know science, you should know common sense. Like you and a plant are different species. You don't look the same. Your physiology is different. Everything about you and a plant is different. So why will you assume it will work on you is very unscientific. You can consume plants because that's different, but doesn't mean you can use their biological mechanism to improve yours. So that's not going to work in either. Even if you take animal-based products, that will not work unless you're are come from humans. So the FDA, of course, market dangerous unproven stem cell. I give example here of a brand, but I don't want to go in detail because I don't like to talk about other brands. It's not fair, but just to give you example how things are. I mean, this product said aesthetic examine the science uses of a new skincare range that formulated using stem cell from umbilical cord lining of a New Zealand red deer. Using a New Zealand red deer or any red deer from anywhere will not work on a human, but this is some of the marketing tricks that have been used by companies. Unfortunately, this product was in London and the UK. I don't think now it's get pulled out from many countries. So again, your science knowledge will help you understand and navigate in your fields. Very important to keep your basic science alive. Of course, the FDA sent them a warning and they get provided, and then there's court orders against all these stem cell products and all these unproven products. So you need to be careful. Of course, a lot of fake products out in the market, and this, your science. And I have my share of saying a lot of complication of people using fake products. So make sure if you are using this product, and make sure you have the publication, the right history of the company, the right background of the company, so you're not using all the right and safe product for your patients. This paper came out in 2012 and evaluating the cosmeceutical containing growth factors and their rules. A lot of people ask if growth factors are safe. For this product has been in the market for over 20 years. Their safety records are amazing. But this paper, just to give you a little bit of peace, this paper came out to show is using growth factor from human, will it safe or not? And then the conclusion, cosmeceutical product containing growth factors as an active principle are safe to be used. So this paper showed that they don't cause any other adverse effects. I have a little bit extra here. Some people ask me about exosome. Exosomes are being in the market, and a lot of people use exosome, confusing exosome with growth factors and this and that. Of course, the science of exosome is pretty much fake. That's what you see right now in the market. It's been banned in the US and other countries are following. Sadly, it's been hyped up using very shady science because they know a lot of people will not know. I mean, there's a lot of people who jump on the hype as opposed to science, and especially when it comes to regenerative medicine, the science is very confusing and it's very misled. So it's easy to squeeze things in. So exosomes are not growth factor. Exosomes have nothing to do with growth factors. It's just marketing. They say, when I discuss it with people, they said, why exosomes? Like, well, exosomes are communicating molecules. I told them, how do you know that? They're like, well, and they shake their head. They're not. Everything you know about exosome is actually false information. So I don't want to go in details, but if you have a question about it, I'll be happy to discuss them with you. I just have, I don't want to spend more time here, but this is the FDA warning of the exosomes. So in case you want to see, there's also CDC warning. There's a lot of warning coming up right now about the use of the exosome. So just be careful. Done. Any questions? I'm happy to answer. So everybody's unmuted, so just unmute your mic and you can speak it out.
Hello.
Yes, hi.
Hi. I really like your pictures that you've got on the acne. Do you have more like current up-to-date photos? Because I noticed that's like 2012. Do you have anything else that we can use like in clinics to promote that product?
For safety, you mean?
So to showcase to clients, you know, the potential results that we can achieve. I already offer things like microneedling RN.
Yes. So which paper as 2012?
Your photos for the acne, if you go back, your photos for the acne results were 2012.
No, this is my example, but there's a lot. The paper I showed you, they're like 2020, 2022.
This one here, yeah.
Yeah, this is just to give you example of my patient. We have quite a lot based on last week even, and today I think there's one too. So this is just to give you example of people who, a lot of the time, the patient will come to a doctor and asking them to do like Botox or fillers for the face, and the doctor will ignore the quality of the skin. So that's affecting the. So this is to give you example how it's very important to treat the skin before you go into injectables. So this is just to give you an example, but this is not a publication. If you want, but the publication I showed you earlier, they're all latest. This is 2021. This is 2020. Like I use the same, and there's like two papers came out. One last year, two paper came last 2025. I didn't list them here, but just for time's sake.
Sorry,
but all the papers are published on our websites.
Sorry, I think you misunderstood my question. My question was, do you have more photos that we can use? Is there like a shared library? Because I've just seen your photos there for 2012. So I'm not disputing your papers. I'm saying, is there anything else that we can showcase to clients? Do you have like a shared library?
Yes, we have the largest encyclopedia of before and afters than any other company in the world. And in fact, we do have it here. And I want to see if we have it here. So we have, we have this, you'll get it once, if you're an account with us, you should have access to it, I think. So what happened is we got from the whole world is any doctors or professional who send us their picture from a patient, they sign it and they put the date and they explain what happened. So not just, you're not going to just get picture before and after. You're going to get the story and the endorsement of the doctor. So you can contact the doctor and say if this is real or not. It's not being photoshopped or altered. So we have quite encyclopedia, this big of booklet. So we'll be happy to provide that for you.
Okay, lovely. Thank you very much.
Any other questions? You guys, I think, can also type it, I think, if you want. If you don't want to speak it out. Thank you so much for your time today. I hope you learned something. And if you have any question, feel free to ask the team, Smart Group, or you can even text me through my social media. I think, let me show you again. How do you put this presentation on? Oh, here, share, right? And somewhere here. Yes. So that's my Instagram, Dr. AQ Skin. So if you have any question, you remember something, you feel free to send me a message and I'll be happy to answer you. And if you're going to MCAS, I'm going to be there. We are on level 2, booth number M216. So just behind the escalator. So if you're there, stop by, say hello. And if you have a question, I'll be happy to share the, to answer your question. So thank you so much for making the time, and we look forward to seeing you in person in the near future. Ciao.